Men and women, I'm Dr. James. Take this seriously, because the right facts make relationships safer and calmer. What really unfolds when HIV goes untreated, and when does that quiet drop become the cliff called AIDS? Per CDC's 2025 release, more than 39,000 Americans were newly diagnosed in 2023, nearly 1.1 million were living with diagnosed HIV, and about two-thirds had undetectable levels, proof treatment works, but too many still arrive late to care. CDC +1. The biggest myth I see is, no symptoms means I'm fine. In reality, silent replication erodes CD4 reserve, stokes inflammation, and sets the stage for opportunistic infections. Damage you can't feel until it matters most. If this question keeps you up at night, subscribe and comment 1, so I know to go deeper. In Solutions, I'll disclose a single golden window decision that 90% miss, and it can reroute your future. Ready to face it together? Comment, learn more too. For anyone who has ever been sexually active, I have 15 seconds to ask you one question. Are you 100% certain you are safe and HIV-free? Be honest. Does your mind wobble between, sure, not sure, and, well, maybe? Because part of you hopes silence equals safety. Denial is powerful. I hear, "I feel fine, doctor," every week, even while viral load climbs and the immune system quietly spends its reserves. Feeling fine is a snapshot, not a diagnosis. Stigma keeps people frozen. They fear a partner's judgment, a family's reaction, a boss's assumptions, the clinic receptionist's stare. Privacy worries become a wall, and behind that wall, time slips away. Misinformation fuels delay. Many believe the quiet stage means the virus is finished, when in reality, HIV continues replicating, seeding reservoirs, and pushing inflammation that ages the body from the inside out. Practical barriers are real. Transportation, clinic hours, insurance, copays, and language all add grit to the gears. When life feels crowded, health tasks feel optional, until they are not. The consequences of waiting are predictable. High viral load persists. The body sets an unfavorable viral set point, and the likelihood of passing HIV to a partner increases with every month of indecision. Small delays compound into big outcomes. Let me share a composite patient. He delayed testing for a year because work was busy and weekends were for not thinking. When he finally came in, his CD4 count was under 180, and his first opportunistic infection had already arrived. As a physician, I rarely see randomness. In nearly every case I review, there is a reason and a chain. A bruise of shame here, a bad search result there, a missed bus, a closed clinic, and then another month gone. It's not just hesitation. It's a chain of small delays that change the outcome. Choose clarity now. Testing and treatment turn fear into a plan today. Let me update your understanding clearly, because fear fades when facts are precise. As a physician, I want you to know what this virus is, where it comes from, and how it unfolds across stages that determine risk and the road back to confidence. HIV is a human retrovirus that targets CD4 T cells. During the acute phase, replication explodes, viral load peaks, and many people feel flu-like symptoms: fever, sore throat, swollen nodes, rashes, and fatigue. This is when transmission risk is highest because the bloodstream is teeming with virus. Your immune system fights back immediately. CD4 counts can drop abruptly, inflammatory signals surge, and then a temporary balance forms called the viral set point. The lower that set point, the better your outlook with treatment. The higher it is, the faster damage accumulates without care. Most of the war is invisible. The gut-associated lymphoid tissue, or GALT, contains many of your immune cells, and it is hit early. Even when you feel normal, reservoirs persist in lymph nodes and mucosal tissues, silently sustaining inflammation and immune exhaustion. Without treatment, replication continues every hour. That constant churn accelerates immune aging, stiffens arteries, worsens metabolic risk, and raises risk of infections and some cancers. People mistake this quiet erosion for wellness because the body adapts until it can't. I am not here to scare you. I am here to help you respond wisely, especially while you are young and your decisions compound. The medical truth is simple. Control the virus early, and you protect the immune architecture that protects you. Do not assume calm means safe. Go for testing, understand your numbers, and act on them with your clinician. Suppression is possible, stamina returns, and relationships become steadier when biology is managed instead of ignored. Silence on the surface, a storm underneath. The peace I trust is the peace that follows a clear, reliable test and an honest plan you can follow. Men, for the next 30 seconds, listen without panic. I am not trying to scare you. I am trying to steady you with clarity. Use this as a quick self-check, not a sentence. In the chronic, quiet phase, symptoms are often vague. You might notice fatigue that lingers, a few pounds lost without trying, or night sweats that dampen sheets. Mouth ulcers can recur, and lymph nodes may swell, shrink, and swell again. Low-grade inflammation is the engine running beneath the silence. Over months and years, it can irritate blood vessels, stress the kidneys, fog concentration and mood, and thin bones. This is why some men feel older than their age, even while lab work has not yet been done. Meanwhile, a sustained high viral load makes transmission easier. Networks matter. A single undiagnosed person can unknowingly keep a local outbreak smoldering. When care is delayed, the virus moves faster than conversations do. Watch the bend points on your timeline. CD4 around 500 means the margin for error is thinning, dropping toward 350 signals vulnerability to infections that a healthier immune system would dismiss. At 200 or below, the risk landscape changes completely. If you finish this segment and your quick check finds none of these issues, take a breath. I am glad for you. Consider yourself 50% more at ease, but let that relief move you to confirm with testing rather than to forget. Do not mistake a good day for a safe year. Track patterns, not moments. Write down night sweats, unexplained weight changes, mouth sores, and swollen nodes. Bring the notes to your clinician. Patterns tell the truth faster than memory. What you do not feel today is still shaping tomorrow. Choose information over fear. Check in, test, and turn the quiet into a plan you can follow with confidence. That is how calm returns. Data, treatment, and time working together steadily. You passed the first self-check, and I am glad for that. But do not get comfortable yet. Please give me 90 seconds to show why the next stage matters. When HIV advances to AIDS, we use a practical definition I want you to remember. AIDS is diagnosed when CD4 cells drop below 200, or when an AIDS-defining opportunistic infection or cancer appears, even if the CD4 count is higher. Think of opportunistic infections as illnesses that exploit a thin immune shield. Common examples include pneumonia, called PCP, toxoplasma infection in the brain, cytomegalovirus retinitis, Candida infection of the esophagus, and tuberculosis or non-tuberculous mycobacteria. There are also gut-driven syndromes like prolonged diarrhea and the wasting syndrome. These are not minor nuisances. They drain strength, nutrients, attention, and hope. One weary week at a time. AIDS involves cancers that flourish when immune surveillance falters and warning lights dim. Kaposi sarcoma can mark the skin and internal organs. Certain lymphomas emerge aggressively. Cervical cancer becomes more dangerous. which is why HPV vaccination and screening remain essential. In emergency rooms and wards, I look for patterns that suggest this turning point. Pneumonia that refuses standard treatment, fevers that last without a clear source, and rapid weight loss are red flags that demand targeted evaluation. Each opportunistic infection is not only an event, it is a steep downward step. After every episode, rebuilding takes longer, reserve is lower, and the future infections find a weaker door to push through. Here is the truth I tell patients, never to frighten, but to orient. AIDS isn't a moment. It's the cliff after a long, unseen descent, and the further you tumble, the harder it is to climb back without scars. If any description here echoes something in your body or your calendar, move now. Testing, staging, and starting treatment can turn a free fall into a controlled landing, and from there into a firm ascent. You may notice I keep striking an urgent tone in every section. The reason is simple. The consequences are heavy, and they multiply. A young man once sat across from me and said, "Doctor, I'm broken. No one will accept me. Even relatives and friends have stepped back." I'll close the details of his story to protect him, but I want you to understand the pattern. Untreated HIV doesn't just strain the immune system, it strains the whole body. Over time, I see exhaustion, persistent pain, and a cluster of other diagnoses. Hearts work harder, kidneys carry extra burdens, nerves misfire, and bones thin. People describe a fog of aches and weakness that steals attention from everything else. The effects are social and psychological as well. Jobs become tougher to keep, income becomes unstable, and relationships fray. Self-stigma turns into isolation, and isolation feeds more fear and poor choices. Some men stop dating, stop exercising, and stop calling the friends who anchor them. Meanwhile, high viral load keeps transmission risk elevated in the background of daily life. One person delaying care can keep a network smoldering for months. Partners who want to love each other begin navigating around a preventable risk. Communities pay the cost in worry, testing, and care stretched too thin. There is also an ethical lane I emphasize. Tell partners, test together, and build simple protection habits you can keep. Courage is a couple's project. Transparency, condoms, lube, and routine screening. When one person delays care, more than one life gets affected. Here's the bright side I insist on sharing. Treatment suppresses the virus, reduces complications, and restores calm to relationships. Support groups and counseling rebuild confidence, while steady habits rebuild health. The earlier you step in, the smaller the crater and the quicker the repair. For the next 60 seconds, hear me clearly. This matters because hesitation in the first 72 hours can decide whether today becomes a turning point or a regret you carry for years. If symptoms appear or an exposure worries you, speak up now, not later. Here are red flag patterns you should not ignore. Fevers that linger beyond a week, unintentional weight loss, persistent diarrhea, recurring mouth ulcers, pain or trouble swallowing from possible esophageal thrush, unusual pneumonia, new blurry vision, severe new headaches, or drenching night sweats. Track dates, take photos if it helps, and bring the list to your clinician. Testing has a rhythm, and following it keeps you from false reassurance. Consider an early RNA test when appropriate, then a fourth-generation antigen-antibody test at 3 to 4 weeks, repeat at 6 weeks, and confirm again at 3 months. Staying on schedule beats guessing. There is a golden window after higher-risk exposure. Post-exposure prophylaxis, or PEP, can lower the chance of infection when started within 72 hours and taken correctly for 28 days. Missing that window is like letting the door close while you are still deciding whether to step through. If you are diagnosed, do not wait. Start antiretroviral therapy early. Early ART suppresses viral load faster, protects CD4 reserve, lowers inflammation, and reduces the risk to partners as you move toward undetectable levels. This is how control returns to your calendar instead of to your fear. If this guidance gives you relief because there is a way out, tell me I choose clarity and share which testing milestone you need next. One timely decision can bend the entire curve of your story, and the bend you choose this week often becomes the life you live next year. Do not wait alone. Professional help turns panic into plan. Fast. This is the part you've been waiting for, because it turns fear into a checklist you can follow today. If you found this at the right moment, grab a pen and write this down, because clarity beats guessing. First, get diagnosed and linked to care quickly. That means confidential counseling, confirmatory testing, baseline labs for CD4 and viral load, screening for hepatitis B and C, STIs, and organ function so we can choose a safe, effective plan. Second, start modern antiretroviral therapy early. These regimens are simpler and better tolerated. We monitor for side effects and drug interactions and adjust wisely rather than waiting for problems to grow. Third, commit to adherence and follow-up. Keep your visits, check viral load at recommended intervals, and if suppression stalls, we troubleshoot for resistance, interactions, or adherence friction before small detours become big setbacks. Fourth, prevent transmission while your numbers settle. Use condoms with lubricant, treat STIs promptly, stay current on vaccines, and remember the destination is you. When the virus is undetectable, you don't pass it on through sex. Fifth, build the lifestyle that makes medicine work harder. Prioritize sleep, steady nutrition, movement you'll repeat, mental health support, and a circle of people who know how to cheer without judging. Sixth, bring partners and community into the light. Invite partners to test, offer PrEP for HIV-negative partners, and speak about HIV the way we speak about blood pressure, openly, factually, and without shame, because stigma is a treatment-slowing toxin. Here is the promised detail you've been waiting for: the golden time window. If a high-risk exposure just happened, starting PEP within 72 hours can stop the virus from taking root. If you're already diagnosed, starting ART immediately speeds suppression, protects CD4, and puts you on the road to UDUU. Suppression isn't a lab result. It is your life reopening. The day your viral load reads "not detected," calendars feel lighter, conversations get kinder, and intimacy returns on your terms, because knowledge, boundaries, and medicine are working in the same direction. For me, quick bursts of effort after a scare rarely change long-term outcomes. Lasting change comes from a simple, repeatable plan you can trust on ordinary days. Use this recovery map to shorten the time from diagnosis to a calm, undetectable life. Weeks 0 to 4 are for stabilization. You adapt to medication, meet your care team, and learn your numbers. Viral load usually begins to fall, and side effects settle with practical adjustments. By months 3 to 6, most patients who take every dose reach an undetectable viral load. Energy returns in pulses at first, then more steadily. Momentum grows because confidence and routine reinforce each other. Between months 6 and 12, CD4 counts rise gradually. Sleep improves, workouts feel realistic again, and focus returns for work and study. This is where many people quietly realize they feel like themselves. Mental health matters as much as lab results. Name the fear, address stigma, and accept help. Therapy or counseling is not a weakness. It is a tool that protects adherence and relationships. Talk honestly about intimacy. Set boundaries, plan testing, and remember you as your foundation for trust. If you want children, discuss safer conception with your clinician so biology and love can cooperate. Rebuild daily life one habit at a time. Return to routines, schedule exercise, Cook simple meals and keep sleep regular. Put your follow-up dates on paper and celebrate each result that moves in the right direction. Continue treatment because it protects you and the people you love. Stopping early invites resistance and uncertainty. Staying the course keeps inflammation down, preserves options, and keeps sex safer for partners. If you want more conversations that are calm and scientific, subscribe and share this with someone who needs it. Your story is not over. It is being rewritten by choices that compound, by numbers that turn, and by people who show up for you every month. Stay curious, ask questions, and keep notes. Small patterns guide big decisions better than memory alone, always. Thank you for staying with me to the end. I'm happy you made it here because it means the message is already working where it matters most. Untreated does not mean unchanged. HIV keeps replicating, CD4 erodes, inflammation smolders, and other conditions hitch a ride on that slow, avoidable fire. The progression is not mysterious. Acute infection, then a quiet phase that still damages tissue, then bend points of CD4 decline, and finally AIDS with opportunistic infections or cancers. Beyond the lab numbers, the costs spread across your body, your mind, your work, and your closest relationships. That is why urgency belongs here, not to frighten you, but to keep options open before the cliff gets closer. There is a door of hope. Test early, use PEP within 72 hours after higher-risk exposure, start ART promptly, take every dose, and aim for UUU. With treatment and support, life after diagnosis can be steady. Recovery milestones, mental health care, clear communication about intimacy, and plans for family and work. You are not defined by a label or a lab slip. You are defined by the decisions you make today and then repeat tomorrow. Remember the golden time window we discussed. Timely PEP or immediate ART can flip the curve when it still bends. When you choose action, fear loses oxygen, numbers move in the right direction, and confidence returns to routines that make you feel like yourself. If questions remain, leave them anonymously for our next session, including how to talk with a partner about testing without turning care into fear. I read every question with respect and answer with science, because calm grows where facts and empathy meet. If this video helped you feel calmer, subscribe so we can build peaceful conversations, and share it with someone who needs it.